Thanks for joining us. We're going to wait a minute or two for more people to join. Hi, everyone. This is Patty Enrado with HIMSS, and today I'm with Swaminathan, CEO of Buddi.ai. We're going to talk about a variety of topics on AI, and we hope our discussion spurs interest in some great questions from you, our audience. So welcome, Ram.
Thanks for having me here.
Great. So let's start off with, a brief primer on all of these acronyms that are associated with AI and machine learning. So first of all, what do these AI phrases mean? So, I'll go down this list. Supervised machine learning.
Supervised machine learning is a technique of mapping a certain kind of an input with an output based on some example input-output pairs, if you will. So as an analogy to healthcare, for example, if you were to automate medical coding, if you were to actually map a certain kind of a clinical phrase as an input to actually an output, in this case would be a diagnosis code or a procedure code. This mapping, which is actually done in a supervised way by an expert, is what we call a supervised machine learning.
Okay, great, thanks. And how about unsupervised machine learning?
So unsupervised is a technique which is essentially looking for previously undetected patterns in a data set with no pre-existing labels, which is not annotated, if you will. And this is another situation where at Buddi we actually use unsupervised techniques to, let's say, segregate diagnosis codes versus actually procedure codes by the means of actually understanding, the context of the data with absolutely no labels.
Great. And how about distributed versus federated machine learning?
So those are new techniques which are coming in. Distributed, ML or machine learning process is to kind of fasten the process of the model building effort by getting all the data into a central location and essentially distribute the model building across numerous nodes, if you will, on GPU clusters, so that you can cut down the time of actually the models being built. Federated model is more a decentralized model, if you will, where you essentially have the data locally, but you just export just the parameters of the models to reduce the time.
Great. And how about active learning?
So active learning is a very exciting model building effort where it essentially can interactively use the domain expert, in the case of a medical coder or a medical biller, actively giving us inputs in terms of actually correcting the machine, in terms of actually an addition, deletion, modification. Now, those new inputs, which the end user, who's a domain expert, has given to the system, is actively being used by the model to train the system to not make the mistake again.
Okay, and our last term, transfer learning.
So transfer learning is another newly evolved concept where it focuses on storing knowledge gained while solving one problem and applying it to a completely different problem not related to the problem. I'll give you an example. Now, you have BERT models, which has actually been released by Google. You have the GPT-3 models, which have actually been released. Now, what if, let's say, a machine learning company could actually borrow some of those models and transfer that to a different problem statement that you're trying to solve. But the original models were being trained on data sets might be a little different, but that transfer of that learning is what we call it as transfer learning.
Okay, great. So what's the difference between RPA, robotic process automation, or bots, and AI and machine learning?
So RPA and bots have kind of evolved, and I think in a nutshell, we are talking about a machine which is smart enough to automate mundane tasks, which are kind of repeated, almost repetitive mundane tasks, if you will, by understanding and learning from what the end user is performing. Let's say in the case of, let's say, a payment posting, in the case of a billing, or some kind of a form filling process which is actually repetitive, more like a UI automation, if you will, with a rule engine which is actually might be powering the RPA or bot. And that's the definition of RPA bot. And was your question actually, did you ask me what's the difference?
Right. Yep.
Right. The difference between RPA bots from AI is AI dives into the context of the content. So if you have a clinical medical record coming in from an EMR, or you have a claims data or an EOB data, which is actually coming in from the billing system, the contextual understanding of what this clinical medical record actually even means is not something the RPAs and bots can do. But RPAs and bots have a place in terms of automation for more repetitive, mundane tasks, if you will. And that's the fundamental difference between AI-based approach and an RPA bot-based approach.
Okay, great. So now let's tackle some of the myths surrounding AI and machine learning, specific to healthcare, and help us debunk them one by one. So the first myth is large clinical and claims data sets plus brilliant data scientists are always a recipe for success.
Right, and I think that's been debunked by numerous teams. And the reason why this large data sets and smart data scientists alone could actually kind of move the needle in terms of the precision, or even the recall parameters in the case of healthcare, is because you need a lot of domain experts to actually annotate those medical records and get to the context of each of those nuances in every specialty and modalities under each of those specialties. So having just large data sets and really smart data scientists just doesn't move the needle. And a classic example is GPT-3. We just recently saw an incredible article by a team of physicians and very brilliant machine learning engineers who really try to understand what GPT-3 can do and cannot do. And they very quickly actually put it to test to a lot of healthcare scenarios, all the way from trying to understand benefits, information from an eligibility response, or trying to actually get a registration chat going on with a patient. And they quickly understood that the machine is not able to understand the context. It's not able to get the time context, or in some cases the clinical context, and all of that is because it doesn't have an expert who's actually annotating, helping, building that context. So I think that's actually definitely debunked.
Okay, so natural language processing alone delivers contextual understanding of medical records. Tell us about debunking that myth.
Right. So I think that's a classic myth, which we definitely have been trying to educate our customer base and the community around us, because NLP is a process which is a natural language processing algorithms. This is like has 14 different sub algorithms, like trying to identify, let's say, where a sentence ends, and there's a whole bunch of algorithms underneath NLP. Now, what NLP really does is essentially it tags or annotates a phrase or a word or a numeric. For example, if it's a procedure or a condition, or is it a normal state? Is it an equipment? Is it a body part? So you can go on and on with almost thousands of clinical named entities, is what we call them, on a medical record, or let's say on a claims data set. Now, in this process, what NLP really does, it semi-structures an otherwise unstructured medical record, or rather even a semi-structured data you get from an EMR in the case of CCDAs or XML form data set that you get from an Epic or a Cerner or Athena kind of EMR systems. But the context is just not still there in an NLP because you only have a whole bunch of phrases and words getting tagged. The next step is the graph. The graph really what? The knowledge graph really reads the correlations between the first paragraph and the second, third, fourth paragraph. The relationship building, all of that is done in the form of a knowledge graph, and that gives you context. NLP is the stepping stone to the context, but that alone is not the context.
Okay. So I know we only have 10 minutes left, so I want to move on to, use cases for AI and machine learning and revenue cycle management. So, how does AI and revenue cycle management help providers in this current pandemic?
Right. So we are unfortunately in one of the worst pandemics in our lifetimes, and AI could actually help automate medical coding and medical billing. 70% are above the volumes they're facing today at 30% reduction of cost with retaining the accuracies of the human or higher, and thereby giving you the savings which is much required by the top 100 hospitals in America, which is actually have complained they're losing more than $1.3 billion a day. So a large hospital, a medium-sized hospital, a small hospital, or a clinic, all of them want cost savings today, and AI could deliver that with production-worthy accuracies by automating, some of these core functions in rev cycle like coding and billing, by retaining the accuracy as well.
Okay, so how does NLP combined with clinical contextual graph assist in eliminating medical coding or medical necessity-related denials?
Right. When you have a contextual way of understanding the clinical note, you have an evidence-based coding. Now, when you have an evidence-based coding, it automatically takes care of a lot of the denials that you might see on the coding side and on the medical necessity side. And of course, you need to have a large rule set, which you have already codified, based on the Medicare and Medicaid AMA guidelines. So the evidence-based approach that we take using a knowledge graph approach really actually moves the needle in terms of lowering these, both these kind of denials.
Okay, great. So I'm going to move on to, talking about, what AI can do to resolve today's greatest issues with the future, and that's the hospital of tomorrow. So in a post-pandemic world, how can AI build tomorrow's hospital? Where would AI be asserting itself in the process?
So the pandemic has exposed a lot of cracks in our system, especially in the public health system we are faced with in America today. A lot of areas, for example, a patient from New York goes to California. The California system doesn't know a lot of the data sets for some of these out-of-state patients, and a lot of these situations can be dealt really well if we can actually apply a lot of these aggregation, summarization kind of technologies using AI, where we can actually help state level departments understand a patient's allergies, patient's historical data sets from an out of state patient very quickly, so that a physician who's going in rounds can actually quickly understand if a patient is allergic to a certain drug or not, and what was the last used drug at what time. So all of this information, I think AI could actually completely eliminate some of these problem statements which we are faced with today in a pandemic situation. And the context, again, coming back to this context is going to be the true winner in helping, in a situation like what we are faced with, to help the amount of triage time for every physician.
Okay, great. I'm going to have one more question for you before we go to questions from the audience, but let's reimagine the EMR of the future. So what role does AI play in the hospital setting for the next generation of the EMR?
Well, in a nutshell, the word EMR would actually have to be reimagined with a contextual medical record versus an electronic medical record. I think that's going to be the paradigm shift. What we at Buddi actually are looking at the future and figuring out how can we build this layer of contextual, lake, if you will, because traditionally the industry has been looking at data going from one container to another container. With that, you're just taking the problem from one container to another container. What we're trying to reimagine the future of healthcare with a contextual lake, if you will, on top of all the EMRs, so that actually the data is seen as a context. That way, we kind of driving down 20 to 30% of labor efforts in America in healthcare. So it's a paradigm shift. It's going to drive down the cost. It's going to improve efficiencies, and it's going to improve outcomes as well.
Great. So our first question from the audience is, could you elaborate on the top commercial use cases for NLP, text-based machine learning, in healthcare?
Yeah, I mean, so for example, NLP could help explain to the patient, what their invoice or the bill they got from the clinic or the hospital. So explaining the bill, which could be very complicated sometimes for a patient to understand, NLP and graph could actually help the patient understand the bill. In the case of physicians, NLP and graph could help almost in real time, can help them the voids in their documentation, because unfortunately, we still document for medical codes to be reimbursable. And if the documentation is not complete, the coding cannot be done, and hence AI, ML, the NLP graph technologies can definitely help physicians to actually, quickly fix some of those documentation issues in real time, versus going through this laborious CDI queries, which is going back and forth, and it may take more than a few days. Diagnosis, is a decision support area, is another huge area where the differential diagnosis situation can also be dealt with some of these technologies that we're talking here. And the list is endless. For example, summarization is an example. Deduplication is an example of how NLP and machine learning could help in solving. De-identification or PHI de-identification or redaction is another example of how we could use. Medical coding automation is a classic example how we could use NLP and machine learning. There's numerous use cases in healthcare where we can deploy NLP and graph technology.
Okay, great. So how does Buddi.ai differ from other AI companies like C3.ai?
Right. Well, there's a generalist. You have the top cloud companies like Azure, you have AWS, you have C3. All of them is what we call them as generalist. You have generalist AI companies which are in multiple verticals, but then you have the specialist AI companies like us, which is actually married to healthcare. And the reason why the community should actually make a huge distinguishing factor between these two companies is because in healthcare, a classic example, again, going back to the GPT-3 model was built on 175 billion parameters, something which actually no human has ever built anything more complex than this. And that model fails in healthcare. But when you compare that with the specialist models that at Buddi that we build, we annotate millions and millions of medical records. We have north of 40 million that we've been training, and the number is increasing by the day. That annotation at the modality level for every specialty, if you take radiology, you take the mammograms or X-rays, MRI, CT scans, you take all of those modalities and you customize that annotation and you curate the NLP at that granular level, combined with the rule engine, which is built by the experts, the coders and the billers and the clinicians, if you will. And that combination is really what is giving us the high precision and recall. And that's the huge differentiation, right? C3s and the AWS and the Azures of the world are not just doing that.
Great. Thanks so much, Ram. And thank you for joining our live Fireside chat today. Up next are other live chat with the speaker sessions available through the listed options, and we hope to see you there. For any questions that we didn't answer, Ram will reach out to those as a follow-up. Thank you again, everyone.
Thank you. Thanks for having me on.